Doctor, can you talk a little bit about your thoughts on the traditional cancer therapies, the chemotherapy, radiation, surgery? What are your thoughts on some of those?
Yeah, that's a big question, huh, Scott? Putting me on the line here. No, but trained as a conventional medical doctor and seeing what I've seen in 23 years, um, it's not hard to realize that traditional treatments for chronic disease have a lot to be desired,
Hmm.
leave a lot to be desired, right? If someone has a heart attack or you have a fracture, the U.S. is the best place to be. You
Hmm.
know, go there, stay there, be there. But for chronic disease, yeah, it's not as good. And there's a couple thoughts. Number one is that in the last few years, uh, the research on cancer stem cells, right? The research on cancer stem cells is finding the following. The majority, up to 99% of cells in a tumor are non-cancer stem cells. The minority population, 1% or less, are cancer stem cells. The same ones that are not affected by chemo and or radiation therapy. On the contrary, it makes cancer stem cells more resistant and more aggressive. So when a patient, they have their scans, PET scans, CT scans, MRI, and they locate the tumor or tumors, and then someone does chemo and or radiation. Then they do their 5, 6 cycles, and then, wait a little bit, and they go for their scan again. Wow, great results. We can't see the tumor, or it's decreased X percentage,
Hmm.
60%, 70%. So everything looks good. And that patient is monitored. Come back in 3 months for another scan. Come back in 6 months for another scan. Well, one thing is you're giving them more radiation all the time,
Each
making them
scan,
even more
yeah.
toxic, right? And
Hmm.
making more DNA and RNA potential mutations with the radiation. As a matter of fact, I'm skipping to something else, but in 2009, there was a publication in the LA Times and USA Today that there was 24,500 new cancers specifically attributed to radiation from CAT scans. And don't quote me on the exact number, but around 16,500 deaths attributed to radiation accumulation from CAT scans. You see, so at Hope for Cancer, we strive to avoid radiation from scans. We like to do high resolution power color ultrasounds where we could look at tumor size, tumor location, but also blood flow to the tumor. Uh,
Mm.
the more blood flow to a tumor, the more active it is.
Sure.
And MRI, of course, right? But we understand that the gold standard of diagnostic equipment is the PET CT scan.
Hmm.
So if a patient has to have this, then we'll teach them, take more chlorella, spirulina, seaweed, homeopathic remedies
Hmm.
to help flush out the radiation, more juicing, more exercise, things like that. So with respect to cancer stem cells and conventional therapy, that's where the research is now. So you're, you're, you're believing an erroneous conclusion by thinking that the shrinkage of the tumor or disappearance of a tumor site means that it worked and it's clear.
Hmm.
It did reduce the bulk, obviously,
Sure.
right? But the cancer stem cells, which are the minority population, those are the ones that will relapse, recur, and
Hmm.
ultimately in a second or third recurrence, the mortality rate increases
Hmm.
drastically. And if we look with respect to chemotherapy and conventional cancer therapies, which was your question, from 1950 to 2005, in 55 years, this was studied in the US where the rate of heart disease, the death of heart disease per 100,000 people decreased by 74%. The death rate for 100,000 people for stroke decreased by 64%. From flus and pneumonia decreased 40 something percent. But in cancer, 5%. In 55 years, the death rate for 100,000 people with conventional therapy only decreased by 5%. So where are the advancements
Hmm.
in chemo and radiation? Where are they, right? And so, those are just some thoughts that I have about this.
Hmm.
I know that there is a place for radiation. If a patient comes to me with a Pancoast tumor, this is a tumor in the apex of the lung, compromising the circulation from the carotid to the brain. If you don't radiate that tumor, you're not going to have the patient. So you have to give spot radiation there to decrease that mass so the circulation to the brain is, again, good. If someone has pain, intolerable pain in the hip or the lumbar from a bone metastasis, you could give spot radiation, 5-7 treatment that will decrease the risk of fracture. It will decrease the activity, cancer activity in that area, and significantly decrease the pain. So there are some precise indications for radiation therapy. And if someone is considering, of your listeners and viewers, someone is considering chemotherapy, I would encourage them to even look into insulin potentiation therapy. Okay, this is where low-dose chemotherapy is used, maybe 10 to 40% the dose of the conventional normal dosage, and the side effects are minimal, if any. And then you combine it with everything else that I mentioned, and at least you could buy, per se, more time to that patient in having some tumor reduction of the non-cancer stem cells, right? While you're doing everything else to make the long-term benefits far better.
Sure.
And another thing is, if you look historically and throughout the world, I've lectured in many places, it's a conclusion that chemotherapy and radiation helps only about 3% of the patients, you see. So, and for example, in lung cancer, if you have chemotherapy, the increase in survival time is maybe 3.5 months by having chemo, but at what cost?
Right.
Right? At what cost?